wicked, the rhyme it is wicked.
Thank you, NAB2 and Women Trades Union. This is incredible. You are powerful in this room, and it is such a pleasure to be here with you. I'm Dr. Christine Moutier. I serve as Chief Medical Officer for the American Foundation for Suicide Prevention, and it's an honor to be here with you today. I am so grateful to NAB2 for the opportunity to speak to you all about suicide prevention and caring for our own. Looking out, seeing all of you amazing women, the words that immediately come to mind are power and strength in community. In the suicide prevention field, we know how important community and connection and a sense of belonging are. They increase resilience. They reduce suicide risk. And we know that for some of you, this is a maybe once a year or just a few times a year experience where you come together in community with your sisters, your other women in construction. And I commend each and every one of you for investing in this opportunity to be here together. Leaders are beginning to see their workplaces as spaces where a culture of safety, respect, authenticity, and peer support improve employee engagement, improve the bottom line, and actually reduce suicide risk for the workforce. I'm a multiracial woman. I'm a mother of two, one trans son, and I am a physician. As a medical student, I experienced my own life-threatening mental health condition. I took time off from med school and got the treatment that I needed. But when I returned to the academic medical environment, I faced a culture where no one spoke about real human struggles, about mental health. It was not something that was openly discussed at the time. And then during my second year of residency training, I was personally touched by suicide when a medical student I had worked with took his life. I was shocked, I was stunned, and it furthered my resolve to find ways to change the culture and allow all of us to seek help when we need it. Fast forward to when still early in my career, I was serving as Dean for Medical Education at the UC San Diego School of Medicine. And I was asked by the students, who are you, this new dean? Come and tell us your story in a town hall. And it was a moment of truth for me because I had never spoken openly or publicly about my mental health experiences and my crisis from before. And I wasn't sure it would be safe to talk openly about it. Would I get fired? Would I be marked by shame? So I wrote out my story. I showed it to my boss, who felt I should go ahead and do it. It was both terrifying and gratifying. I didn't get fired. And not only that, I became a safe person in the medical school and in the health system in San Diego, someone others could come to without fear of judgment or shame. And since then, I've dedicated my career and really my life's work to preventing suicide because of starting with my own lived experience and losses to suicide. And of course, I care about patients deeply as well. So take the risk and share more vulnerably. Others will feel seen. They'll understand there is safety in prioritizing their own mental health and living more authentically. People need to know it's human to struggle and it's strong to seek help. In the suicide prevention world, it's a very exciting time. It's a time where there's an acceleration in scientific discoveries that are providing answers about what causes suicide and what protects against suicide risk. And the scientific field is also providing us with new interventions that are effective. So a few important scientific discoveries I'd like to just briefly mention are a couple of things. When a person is in that level of stress in suicidal crisis, there is an experience that happens in their brain physiologically that causes an experience of tunnel vision. It makes it difficult to assess healthier coping strategies in those moments, just temporarily. So if someone can get through those intense, usually short periods of crisis, chances are they will go on to regain their healthy coping strategies and go on to live out their full life and will not die by suicide. So helping people stay safe can be life-saving. Limiting access to lethal means dramatically decreases suicide rates. More than 90% of people who die by suicide had an underlying and potentially treatable mental health condition. So getting effective mental health care and managing mental health and substance use problems is essential. We at the American Foundation for Suicide Prevention want to be a resource to you, your coworkers, and your family members. With 73 chapters across all 50 states of the US and Puerto Rico, we embody stigma-free community and connection. We're the leading private funder of suicide research globally, and our investments have helped shape the field to answer these critically important questions and produce actionable strategies that can be implemented. We provide suicide prevention education programs and loss support. And with tens of thousands of volunteers, we advocate for policies at the state and federal levels that reduce suicide and improve mental health services. And our Out of the Darkness walks, which began 20 years ago when no one was sure if people would even come out for them because there was so much stigma and suicide was kept in the shadows. But we've seen tremendous growth of those walks year over year. And that's an issue that reflects the culture changing, where we can talk about real human experiences around mental health and suicide. And at our walks, individuals know they are not alone. They're standing in a community of people in solidarity who are making suicide prevention a priority. We have a new, exciting partnership at AFSP with the Bechdel Corporation, where we are advancing a movement to treat mental health safety with the same priority as physical safety. Now, among occupations, unfortunately, construction industry has one of the highest rates of suicide. And thanks to Bechdel, NABTU, and other participating industry leaders, we will be listening to all of you and the data and the science to develop resources that make sense to you and your colleagues. We're aiming to reach 500,000 construction professionals with this project, and we invite you to join us. Never underestimate the role you can all play in preventing suicide. Don't be afraid to ask your coworker, family member, or a friend, really anyone you're worried about, if they're having thoughts of ending their life. Help them to make their home environment safe and secure of any lethal means, or simply listen to what they're going through. That in itself can be incredibly therapeutic. We have resources that can help guide you on how to do all of these things. Be sure to attend one of the suicide prevention and construction panels this afternoon with my AFSP colleague, Shannon Limjuko, to learn about risk factors, warning signs, and how to start a conversation with someone you're concerned about. We all have a role to play in preventing suicide. Thank you for what you do each and every day. Be well and enjoy the conference. Thank you.